think Massachusetts can be with us either. So maybe we'll just do a kind of quick update and see what you're up to. I'm looking at notes from last time, and we had talked last time about what challenges states have been encountering during the pandemic in meeting their goals and objectives, and how their leadership has changed. And we just got a sort of general update from all of you. So maybe given the circumstances in the world right now, we'll kind of continue with that. And then anything else that you want to share, or any help that you need. Washington State, Jill, I know you just got the toolkit a while ago, and you were kind of waited till the summer to tackle it. So I just want to offer our help again, and kind of bringing you up to speed and getting you some documents that we've used before to make it more navigable and easier to use.
Yeah, that would be awesome. Tracy has it, but we probably won't be back into the office itself until September.
Right. And yeah, so that's fine. I'm just putting it out there. It's formidable at first glance, but we've found a way to make it pretty easy to use.
Yeah, no, I would appreciate the documents, that's for sure.
Okay.
And yeah, I think I think right now where we're sitting is really just kind of, we've got the no cost extension. We're waiting to see about the continuation grant, and and we're looking at just kind of what's out there to see, you know. At one point in time, I think Linda had talked to the Parkinson's Association in Washington State, and they had seemed interested, but at this point, they're still managing their own respite component. So, but that may be someone will, because they had asked about it previously, we may kind of revisit what some of the barriers were for them to go through us, and kind of address those issues. If there were, you know, if it was logistics, what could we do? If it was concern for a third party coming in, you know, whatever those might have been. Because we do have folks coming through who are impacted by Parkinson's. So it just would be nice to kind of connect both pieces so that it's got good solid coverage across the state.
Yeah, it would. So what were you thinking about, like the nature of the relationship, or have you even thought that far? Are you just kind of opening conversations?
I think the conversations were between Linda and them. So I think for us, it's reestablishing a connection that may have been kind of disconnected when she went back to Homage. So, but you know, that's one of the things we've looked at really. I mean, and this is really kind of outside the box, but it is folks who I'm sure could use some support, is the caregivers for individuals with AIDS in our, and HIV positive in our state, who are kind of dealing with the more complexities that come with that. And we have some youth that are impacted in our state. So it was something that we were kind of looking at, because there's a different kind of funding stream that comes through that's connected with AIDS that we might be able to look at. And
well, I would say two things about that. One, I think one of the things I've noticed about Washington State is that you're good at finding underserved populations. And forming relationships so that they get services. The other thing is that one of the things that we all know is really important to sustainability is diversified funding. So it's really great that you're thinking about that. When you look for underserved populations, there may be different sources of funding available. So you can kind of garner those resources to do that. That's fantastic. So
can I, this is Jutta, can I ask sort of a tangential question to that? So you just talked about, you know, different populations, underserved populations, and I totally agree, that makes sense to me. But what is everybody's thinking about lifespan respite serving caregivers or families that are basically eligible for services like from the area agencies, but for some reason choose the lifespan respite? Is that a conflict? Are we supposed to serve only people who are not eligible?
Can I address that?
yeah.
That is completely up to you. That's where the flexibility comes in for your state. I mean, if your lifespan respite grantee has determined that these would be unserved populations otherwise, you know, I think you probably should encourage them to utilize funds that are available through the AAA if they're eligible. So that, you know, if there's a waiting list for AAA services or they're not eligible for some reason, then you could at least document that. But it is totally up to you who you choose to serve.
Yeah, okay, that makes sense. So we have one here in Arizona. We had one area agency that got really mad at me because they you know, we use the same system for data, and they saw that we have a client that they had talked to earlier. The client chose the lifespan respite, I think, because we allow the you know, friends and neighbors and family for the voucher, and the area agency doesn't have that option. But the AAA got really mad at us, and I kind of put the burden on our state agency to say, hey, come up with a policy for me, please. So
yeah, that's a real internal.
Hey, Jill.
You have to have.
Hey, Jill.
Okay.
Yeah. Hi, Cheryl. We're so
Hey,
glad you joined us.
still alive.
Love seeing your face.
Tracy and Brittany and everyone has been just taking the lead on everything. I did want you to know I'm still alive and well, but I thought I'd answer Jutta that in Alabama, we have our lifespan funds for those that are not already receiving services on a respite program, whether it's AAA or a waiver. And the only times we usually provide that is if they've exhausted those funds for that year and they have an emergency need. But what we've done is, in partnership with our Department of Senior Services, who has encouraged all of our AAA programs throughout the state, we have 13, to contract with us under the personal choice option. And we have almost all of them that we've entered into a memorandum of understanding that we will become their voucher option. Since they cannot fund individuals, they can fund us, and then we reimburse for those families. And so that's how we've done it to get around that. But we do have contracts with all of those AAAs, and our messaging was that this gives them personal choice.
I like that.
Perfect.
Person-centered. Would you, Cheryl, would you talk a little bit about that MOU process, and is that if just for you to, like, if she wanted to pursue something like that, how to make it friendly and like what, you know, what the use of it is? And
so let me get refocused on respite. It's been a while. So with all this COVID, I feel like that's been my world. So we've always offered the voucher option, but so many state agencies and others cannot directly reimburse individuals when they don't allow for the choice of the family member. They have to be over a certain age and not living in the home. But if that is their choice, and in the COVID world, obviously they don't want the revolving door of the home health, or the home health is swamped because of the shortage and people being out sick, and they can't cover all the needs. So if you can train someone on your own, or you have a family member that you hate to just keep asking for that favor, to keep your child, then this allows you to ask and pay so that they don't feel like you're a burden, you don't feel like you're a burden, and the person isn't paid much, but it's not like you're trying to take advantage of them. So usually they will allow someone that they know, maybe it's even the aide at the school. It could be someone that is a Sunday school teacher at church that has a relationship with you and you trust. And so, especially in COVID, limiting and having the same person come has been more favorable for families. So we went to the Department of Senior Services and did a training when they had all the AAAs at their quarterly meeting. And we told them how the voucher works. And we each of our AAAs has the governing body that has their own contracts, but we have like a scope of what we will do as the addendum. And so we just told them that we would be their option. And we've historically had a few, but some were hesitant to lose that control of communication and everything. And we keep trying to say, not just taking your client, you'll never see them again. We're more the fiscal partner of that. So they still do the eligibility, and they give us a list of who is eligible for what amount. And then we execute the voucher and the paperwork and give reports back. But the case management and everything still stays with the area on aging. And then they can ask how it's working, are you using the funds? But so they don't lose that connection. Mm-hmm. So once we proposed that, initially we had a few, but some just skeptical how it would work and if it's more work on their part and all. But basically we do have a small handling fee for our time and postage and everything. But basically they just pay us to do that role. And now in the last couple of years, we've actually pretty well, I think we have all but one, there's one that's just never going to outside partner. And then I think there's maybe one more that we're working on to see if we can do that relationship. But I think we have 11 that we have entered into those contracts, and having the Department of Senior Services endorse this as a centered, a person-centered personal choice option. And everyone wants to have that in their reports anyway, that they are family focused. So, and they didn't know how to meet that need in their documents. Mm-hmm. So they said, well, here's a group that can do that for you. So it's really kind of opened the door. So we mainly go to those meetings, talk about who we are, what we do, what we can do for them, why it works for families, and why this model might be better for rural families or those that have very medically fragile and they don't want the constant turnover of staff coming in and going. So we talk about the benefits of it, and then usually, we've had great success, and as the word of mouth goes, sometimes they'll start out with a few, but then more and more caregivers are choosing that. So, and then when they see that the caregivers want that, then it kind of validates that it was a good decision to do.
Yeah. Thank you so much. I kind of just wanted to unpack that because we're always talking about how relationships with other organizations, shared leadership, shared resources are so important for sustainability. But, when you say that, it sounds like this simple thing, but in fact, it sounds like you work over time. You're really explaining the benefits. I mean, the relationship, it takes some work, especially initially. and some giving back of like information and data and making apparent what the benefits are for families. I love how the personal choice and person-centered, but also for the organization. It's good to have partners for them, not just for lifespan respite. So,
and once you're able to get one on board and they see how it works, then actually in our first partnership, at 1 year they had 96 of the 105 choose this option once they started becoming familiar. So we do almost all their respite so they can focus their time on the other services that their agency delivers. So she became a very strong ally, and we've been doing it for years with her, and it's just been slow. But the last couple of years, I think we started to get more traction with a little change in our Department of Senior Services. They were messaging in. I think a long time ago, an employee said, "Oh, they can just take that whole thing over for you." Well, that wasn't what they wanted to hear. It really created the impression that we were taking those clients and taking that. And so that, I think, is why it was slow. Once we kind of changed the message of the messenger that, no, we can relieve this burden from you so you can focus more on what you need with your families and just take all those headaches away from you. And we're here to help you. And it became a much easier sell.
Right. That seems like the good message for you in that situation she's in. Thank you.
Yeah, this is great. This is Jutta. This is great. Thank you so much for sharing. And I've made some notes and I have some ideas of how to now go back to, my state agency, the Division of Aging and Adult Services, and approaching that area agency. Thank you.
Cheryl, while we have you, last time we talked about COVID-19 and how it's changed. People talked about having virtual coalitions, talking about how they were holding leadership meetings and how they put certain parts on hold. And I wondered if you would mind just giving us an update on what's going on with you, any changes because of COVID.
Well, we did, I don't know if Tracy's been on some of those calls or not, but we shut down for the 2 weeks and did everything by phone as in March, as requested by our state. But we still had access by phone and messaging and emailing and all that. But during that time, we were able to completely flip our trainings over to virtual. And we never stopped taking emergency respite referrals, but we did work from home for a good while. And so when we flipped to virtual, we worried about our senior population not having technologies or access, but our training numbers have gone up. Our staff doesn't really want to go face-to-face anytime soon because the numbers and the reach and the new audiences have changed so much. So Alabama's opened up for business, and all of a sudden our numbers are getting out of control. So it'll be a while before we put girls on the road, but we will maybe do a few targeted things. But right now, they've changed programs to be online. It's flipped to conversations like, how do you set up Zoom? How do you do these things so you can participate in training? So a little more simple technologies. We have a chat, where you can call in, and even if it's not about COVID or respite, if you just need to talk to one of the social workers to try to limit the isolation. So I've got something with the experts with my therapist, and I think this is a chat, the word chat with the respite. We have so many programs calling things differently. But they have really tried to be creative with how they deliver services. If they used to give stipends for respite if you attended the training because you needed to care for the loved one at home to be able to attend, we might still give stipends, but now we're doing the care packages. We offered and had donated or purchased masks for all of our staff personal families, all of our client families, and all of our caregivers that requested it. So since we have just now started seeing some therapy clients in the center, what we did was we mailed those masks out, and we haven't sent them all out, but we had over 700 cloth masks. We still have a few, still to give out. And then we have hundreds of the disposable for when clients resume in the building. But we had quite a large number of mask maker groups just making masks for us to give out to our families and their siblings, parents, the whole family unit. So Tracy's been mailing as requested to any of our caregivers because we realize most of those are elderly and not able to get out, but they might have people coming into the home. So we have had requests for that. My COVID world is each program is different. I'm trying to think with respite if we've done anything unique. They've just really tried to be creative with partnering with Colorado or doing other things to try to get other experts. I think we have another technology one coming up that's simplified, but we just talked to someone that does more of the smart technologies. So we might be offering that just to try to make life easier for the caregivers. But they're always coming up with topics and stress and care and different things. So those are going so well. I don't think we're going to stop those now that everybody's got Zoom access. It was limited before.
So let me ask some questions because I participated in this, the COVID study that the Break Exchange did. And one of the things that came up was that not every organization was able to respond really quickly. And we don't know why, but when I hear you talking about getting that training up and going in 2 weeks, and you have such a good sense of what's going on in the field, you must have some kind of feedback loop that's working. Can you just think aloud with us about like what makes your leadership able to be so quickly responsive, so in tune with what's going on in all the different programs? What is it about the way you all work together that makes that possible?
A couple of millennials. So in the disability world, which is really our base, we used to have technology programs, and we used to run a state website, and did have like Tracy, who's over respite now. We used to run a training program statewide for our state on assistive technology. Mm-hmm. So between her leadership of understanding how to deliver trainings, and Brittany, who understands, and she comes from, like her husband used to be in with Verizon and doing a lot of technology-based services, even though he's not in that right now. She is very tech savvy. So I think just from a personal level of understanding on all the social media and platforms, and our experiences previously with trainings that were either recorded or provided statewide through other programs, we just, made that possible. Our assumption was that individuals that were older don't have access or comfort with technology, so our numbers would go way down, and it would be more of a disability or a younger family with a child with a disability that would, maybe it was a younger caregiver caring for a parent, but we've been really surprised that, maybe those younger caregivers are at home and worried about their parents and trying to find those solutions more, but they have reached out more than we thought, and it's going well right now. Yeah. So I think from a leadership standpoint, the messaging here has been, we still have to do our job. They're still needing us, and we've got to be creative on how we reach out to them and deliver those services, because closing up, and while I say closing up for 2 weeks, the board did give them 2 weeks additional sick leave across the board to do our mandated shutdown, but that allowed, and management was still in working, but we actually sent everybody home the week before and told them, you figure out how you're going to deliver. So we have story times online, we have play groups, and we do share a lot of tip or parenting article or something every day, even on the weekends apparently. So we just schedule those out. So so we have really our entire organization, every program has delivered services in a different way, whether it's telepractice, Zoom, social media posts, Facebook, but we have flipped what we do to a lot more video and a lot more virtual. But the message has just been consistently, the need doesn't go away. Just because we can't see and touch and feel them and be present, we've got to be creative on how we deliver these services.
Yeah.
And so every department was mandated with the challenge to figure out how to continue their job in whatever their role was with UCP to where we're still seeing families and meeting needs.
I love you said you figure out how you're going to deliver, because that seems like if you have that, I mean, it's a mandate, but it's also a kind of support, you know, that this is the expectation that we're going to continue to serve families. I think that's like motivating and supportive of what you have to do, even if it's challenging and you have to be creative. That's so cool. I think that's fantastic.
Well, I figure it's what everyone's doing. It's just trying to think differently. But I think we just didn't realize this would be ongoing. Yeah. So we were able to respond quickly. Now the challenge is how to keep it fresh and still meeting the needs and, you know, even expanding what we're doing, because we did do some things thinking it was just going to be short term. And now we realize this is going to be ongoing for some families and vulnerable populations. And we do serve both, you know, vulnerable populations with disabilities and medically fragile children or those at risk. Yeah. And then we also have the aging. So, but we're used to universal precautions, live it every day. You know, when the media asks, what are we doing different? You know, past virtual, we're doing what we've known to do all these years. So
yeah, that's so great. So thank you.
All right.
Jill, did you have
I'm going to pause for just a minute. I need to go hand somebody my credit card so I can have it. Hold on.
Jill, did you have things you wanted to screen share today?
Do I?
No, other Jill Macosari.
Oh, sorry.
I hadn't anticipated doing that.
No, I don't mean to put you on the spot. I thought I got an email this morning that had some attachments and I didn't have time to open them up. But so please don't think you have to. Oh, sorry.
Oh, okay. It may have come from Tracy.
Yeah, it may have.
And Tracy had to jump off and go meet with the grant officer. So I'm not quite sure what she was. Let me pull up that email and see what she had
but no worries. I mean, we don't typically do that. I just.
I think she just sent me a calendar event.
Oh, okay.
So I'd have the link.
So, do you want to talk a little bit more about what you're doing in Washington? Like, have anything's changed since last month? And
I'm trying to remember what we talked about. I know for us, we have continued to add respite providers. So that's been kind of exciting because we have no counties are past stage 2. Phase 2, however they say that. We do have some of our smaller counties that are entering into phase 3, but there's still a lot of restrictions as far as, and now the state's on, starting today, masks are required for everyone. And so, I know that FEMA has created some great access points for PPE for organizations that have a hard time or don't have the funds to access that. And that has been a good connection for us to give to our respite providers so that they can, you know, they have access to that for because we're under ALTA, we use licensed organizations or camps, and we're looking at different city and regional recreation providers as a new kind of outreach into, I know that some families had requested maybe classes through like the community colleges.
Like
And
virtual classes or actual? Or
well, now most likely it will be, we'll see what happens in fall with, I think they were hoping to be actual classes. We'll see what community colleges and universities are doing. I think that there is the anticipation that they will have a kind of a limited opening. I know based on the school district, what fall's going to look like is going to be unique to each space, I think, as far as, and I think that we've also definitely looked at where there were areas where there were less numbers, and trying to build access in those, and encouraging people to look depending on their transport, you know, their ability for transportation. Can they see outside of their smaller sphere? Can they look, if they're looking at camps, can they look at the county over or the county above for a camp space? And that's for younger populations.
So are you trying to facilitate that kind of centrally? Like, is that happening?
We have on our website, there we have a list of all the providers in all of the counties that they're in and all of their services. That includes camps. And an individual or a support person can go in and look at all of those providers and where they are. They can go in and target. I need, you know, and they may put in 3 counties, they may put in, they need in-home services, and they need, and they can specify.
Right.
And then it spits out this, that's one thing I probably could screen share, is that portion of our website. And then they have a kind of a tailor-made, thing that they can pull up. Let's see.
And then, so they're looking for kind of individual programs, and do you know the status of the individual programs, or they kind of have to, the family?
Yes. We have somebody who that's their job, is working with what we call the RPAs. And she works with them monthly. We use Salesforce as our data system on the back end, and the forms that we use ties directly into the Salesforce, so we can pull up reports based off of, you know, do we have their insurance? Do we have all of their data on who for invoicing? Do we have all the data for the counties that they serve, the types of services that they have? She can, in any day and any time, pull up that information, and she connects with them personally. So she calls them, she emails them, and so that all of our stuff is up to date.
That's fantastic.
And they've also gone to a kind of an auto reminder system. In 2 months, your insurance is due. In 2 months, we need to look at, because things are kind of in that waffly period. We've got the year no cost extension. All of the contracts were due to end when this granting period ended. So we're working on extending those within that extension and waiting to look if we have the new continuation grant, is there anything that also wants a little differently in the contract, and then craft the next one. And then we'll just go back through that with all of the providers.
Right.
But I think when we started a year and a half ago, there were 19 providers. And I think we're up to 58 now. And so and I think we've covered all but 3 counties. I'd have to go back in and look, but so that there are options for families to look at, you know, with some of those providers, would they cross county lines to come and provide support and services? So I think the biggest barrier has been now is that families trusting.
Right.
You know, making sure that so we've tried to create the encouragement between the two, that the providers up front say, this is our safety protocols, these are the things that we do to provide safety for your family member as we come in, or what we do, so that there is, and that the family can say, we need this, this, and this because of, you know, their medical condition or the amount of folks we have in our family. So I think that's been that communication back and forth, but families are really starting to come back through the door again, so.
Okay. That's great.
Yuta has a question. I don't mean to interrupt. Want to help her jump in?
Yeah, thank you. You were just talking about, you know, your respite providers, and that you have somebody kind of keeping their information up to date and apparently checking that they have insurance. Do you have other requirements? It's kind of a two-part question. Do you have other requirements for your respite providers? For example, training. I'm specifically interested in what training levels. And the other question I have, because it came up here in Arizona, if we can do that, do you track if they can take basically emergency referrals, you know, or those calls, like it's Friday afternoon and somebody calls and says, I need a respite provider now. Do you track that with your provider list?
I don't think we have. I think that might be a good suggestion, Yuta. I think the protocols are pretty connected to the home health program through ALTSA that we have here. So when they built the lifespan respite, the state did, and they really looked at what the state was willing to have through the lifespan respite program. I think there was, you know, do you do background checks, and do you know, what kinds of services do you have? If you're doing high complex needs, do you have license for their care? If you have somebody come in and do complex care, usually we don't have something like that. That might be the emergency piece that you're talking about. Usually it's just home supports, so that the caregiver can get out. But right now, where are they going to go? It's kind of the grocery store, I guess, but there's not a lot for getting out. You can, you know, so far they can't go to a movie, or they can't. There are very few restaurants that are open. It depends on which county you're in, but they're figuring it out. Families are figuring it out, how to get their break. And I think that because it was based off the home health model that they have, there's some pretty, there's some restrictions, and that it has to be a licensed provider, and those licensed providers have gone through the licensure with the state. So all of those pieces are in place. And that I think that the camps were a little more tricky when they started adding camps, but they've been doing that for a while. I think that's the ask is a little more, some camps are like, no, because of the ask. It's not just, oh, sure, we'll take your thing. It's like, well, sharing their information, sharing the licensure. Some are a little reticent, but Nancy does a really good job of talking with folks. Did I answer everything? I tend to get a little wordy. I'm sorry.
This is Jill at Arch. Can I jump in for a second? And Jill in Washington, you can correct me if I'm wrong. Washington State is a little unique in that they do have pretty strict requirements for home care providers in terms of training and licensure that Jill was talking about. And when the state aging agency took on the lifespan program, they are mandated by state law to follow the same strict procedures for who can provide respite. That's very different than most other states. I think Colorado is the only other state that has a consumer-directed program, but families can only choose from a vetted list of providers. They can't choose family and friends. I think all of the other voucher programs, and Cheryl, I know for a while, I think you could only select a vetted, way back in the early days, you could only select a vetted provider as well. But
gosh, that's a while. Oh, I did it too long.
If I remember, you must remember. So Washington's a little bit different there. In terms of the emergency respite, many of the grantees have developed respite vouchers specifically for emergency care. And again, there, many families are on their own to find the providers, which is okay if they're using their own family and friends, but it's very hard to find a more formal provider that's willing to provide that respite, in 24 hours because they have screening requirements and limited providers. So what Maryland did with their lifespan respite grants, they used them for emergency respite vouchers, but they also contracted with a statewide home care agency who agreed to provide emergency home care workers in conjunction with their emergency vouchers. Families can still use their emergency vouchers to hire anyone from their family or friends, but if they don't have anyone, they at least can they will know that this home care agency will send them a provider on short notice. But it was a specific focus on providing emergency care with specific guidelines for emergency care for their vouchers. So it wasn't just, oh, somebody wants emergency care through our vouchers, maybe we'll try to find it for them, but it was more deliberate than that.
Yeah, in Alabama, we focus so much on the person-centered through the regular voucher, but on the emergency, we do allow the home health and have talked to home health to facilitate that payment arrangement because, they may have no previous if the family's not ever used home health before and we're referring them and saying we're paying for it, we do what Jill mentioned as far as trying to at least have an avenue. They can go get their own home health if they've used someone before, but we do try to have an option for them because if the caregiver dies and family's got to fly in, we got to stabilize it pretty quick. We have to have something beyond just maybe the neighbor, we have to put in something in motion quickly.
So Cheryl, just to clarify, like Maryland, you have some kind of agreement with those home care agencies to provide respite on very short notice.
We have. I'm not sure what Tracy's doing right now as far as the financial arrangements, if it's more informal, because we work so much with them, but I think we have at least one. I know we have some informal ones. We used to have a formal when we first got started because they didn't know us very well. Yeah. I think that's expired, but we keep doing.
Okay, that's very helpful. Thanks.
Yeah, but I wish Tracy was on the call. Sometimes they'll change things, and I'm the last to know. So, they say that didn't work, Cheryl. We've moved past that. I'm like, oh, okay, well.
That brings up a point that I think we really hadn't had a conversation about in our state is really, you know, especially with COVID, having options for if the caregiver gets sick, if the caregiver has to be hospitalized and beyond. And so that definitely, I don't think has been on our radar. And so, and thanks for bringing up that piece, because I do think it's something that's critical to look at, especially like for overnight care. We have very few overnight care places. I think we have one respite care provider that is an overnight for medically fragile kids. That's a part of our group, but I don't think we have more than one. So it's good to think about.
Especially now, since I'm imagining nursing homes don't want to take in anybody.
No, they won't. You still
So, yeah.
still can't go into nursing homes at all. So.
Wow, it makes me wonder about what kind of need is out there that we don't know about in each state.
Yeah.
Jim McCormick, you talked about the safety protocols for the providers that you have on your website. Are they generating them program to program, or is there anything coming from the Lifespan Coalition leadership about any guidance or anything, or how are you working that?
No, because I think it's covered under the licensure. So that's kind of, I think the specific training we're trying to track. So training for TBI, training around, because we have the Reese Foundation funds, the paralysis, spinal cord injury, spina bifida, maybe transferring, and some of the more unique needs to specific communities. We are starting to see more and more folks come through the door from behavioral health. So that brings the behavior aspect. So that's kind of a new shift in some of the things. So it's not so much the medical support or kind of the basic care that you would see. They require a little bit more. I know that our TBI Council is doing trainings, so that they're inviting the provider agencies in to do specific training around TBI. But those are some of the questions that are asked, but so that we get that information. But the basic licensure, as long as they're a licensed provider, then we don't have to ask all those questions.
So related to that, like when families are selecting, they kind of, I know what some of the organizations, or not organizations, but like my dog groomer, the cleaner, they send us guidance about how to let somebody in your house if you choose to.
Oh, yeah, we've got that.
Yeah.
That we try and when a family goes through an application piece, when they get a voucher, they get the award, and they get a series of tips and questions to ask providers when they go to look for a provider agency. They have the vouchers have been 90-day vouchers. So there is check-in times if they haven't said, oh, now we have a provider, this is when we're starting. So if we're a month in and they still haven't chosen a provider, we check in, are there barriers? Are you having issues? What's going on? How can we help? So that there is kind of that support. Yeah. And if they ask for a support right away, of course, that there's somebody there to help. Right. And so I think there's we've had some folks that are like 60 days out and still hadn't chosen a provider and this kind of like, you only have this amount of time to use this voucher. So that but we don't have too many folks like that. I think it's more that there is a written support, but then we also do the check-ins so that people get the verbal support in kind of navigating that whole process.
And that sounds like that's always been there. Have you adapted that at all for COVID? Like in addition to selecting these are the safety precautions you should take?
Yes,
Okay.
there's some additional COVID,
Yeah, fantastic.
For those of you who might need assistance in that, I just want to remind you that ARCH will be releasing some voluntary national respite guidelines, hopefully next week. We're frantically working to get those finalized and laid out, and they include things like a provider decision guide, a family caregiver decision guide that will help people decide if they want to reopen or use respite.
Let's see if
that'll be helpful.
I probably need to fully disclose. We ran out of respite voucher money, or promised it out so quickly. We got another 15,000 and ended up holding that just for emergency or new vouchers. We've pretty well committed all that out and are actively writing grants, and we'll try to seek some of the state's COVID. Our state's trying to not do for past losses, but how you're going to go forward, supporting those with COVID related. So we're going to try to get a little bit of money that way to address some of these emergency situations with the caregivers and COVID. But we've flown through the money, and it looks like, we did submit for the federal grant the next cycle, but our state needed a little more for some things they were doing. So we're actually going to end up with a little bit less. And we were out so quick this year. So we are writing extra grants just to try to deal with some of this. And our agency most pressing need at the moment is, thanks to the PPP, is just this entire respite situation. So that's what we're mainly writing for right now. And then I don't know if it comes back how we're going to continue to keep the funding. It's such a need, but
I know state budgets are really struggling right now, but you all in Alabama have had other state funding for vouchers in the past. Have you been able to hold on to those? And
we did not ask for an increase, which we had thought about. We just asked for level funding, and at the time everything was happening with COVID, we're hoping that they don't go into proration. But our state set up rainy day funds historically because of the issues we've had with proration in the past, when income fell below what was awarded for the year or budgeted. So our goal, hopefully, is that they will dip into that this year, since we're already in a budget year. And then some income increased and some definitely were impacted, but it just depends on how long this goes. Right now, they were very optimistic that we would have actually a little bit of growth in our state budget. So they took originally it was pie in the sky. We were going to have all kind of record economic year and $400 and something million new money just
gone away.
Yeah. So they went back to last year's budget and did award more money, just nothing like the other. And we're mainly out of the education budget and use our federal dollars for the respite, because that would normally come out of our general fund, which struggles. So all of our growth taxes are in, and we're one of the few states with two separate budgets. So most of our staffing awareness and the training is out of the education budget, and we were able to keep that level funded. So we felt that was a victory in itself. But if they've overextended or they have supplemental funding that then throws us into some kind of proration, you usually don't know about it until the very end of the year, and they say, make all these cuts. Well, at that point, it's going to be salary. So we do have some reserves we're holding on to. If that happens, that our agency can keep the staff going. But the actual respite voucher awards are our biggest concern. We've covered the staff, we feel pretty well, but it's tough to do your job when you say you really need a break, and good luck finding it. So
yeah, exactly.
That happened last year with we had a DOH, Department of Health, Children with Special Healthcare Needs respite, a small grant, just 10,000, that was linked to lifespan respite. And last year, that the Title V sustained a good solid chunk of change that got cut, and it's going to be even bigger this year, I'm sure. So those funds went away. So we're hoping, we're trying to go back to the local health jurisdictions and the children with special healthcare needs nurses and saying, lifespan respite didn't go away. The DOH funding did, but you can still connect your families to lifespan respite. So I think reestablishing those connections with the local health jurisdictions also is kind of one of our targeted communities to outreach to and reestablish.
And Jetta, what part of, did I hear Arizona? What part of Arizona are you? And what group are you in?
I'm with the Arizona Caregiver Coalition. So we're a small nonprofit trying to, kind of rebuild the respite coalition here in Arizona. And we are contracted with the state to, manage the lifespan respite grant here in the state. It's statewide, right? And so we have a voucher component to our program, again, statewide. And then we have a lot of money allocated for adult day center respite.
Have you ever partnered with the UCP or do you have anyone on your coalition from the UCP? I don't remember if Phoenix has respite specific programs. I know our national CEO is from Phoenix actually and is based out of there.
I'm slightly embarrassed, but I have to ask you, what is ECP?
United Cerebral Palsy.
Oh, UCP. No, we don't actually have a relationship with them.
So Armando's not with their affiliate anymore, being from the national office, but I'll have to ask him next time I email him about whether Phoenix has respite, and they might be a good partner, or they certainly have a lot of clients and a lot of legislative expertise, I would think. They have a really good program out there. So yeah, if I can introduce you, I'll be glad to.
I love that.
That would be a wonderful partnership for you to.
Yeah.
They may not have money or respite programs, but I know they're going to have the need, and they'll be a great partner to validate your needs if a letter of support or something maybe could come from that. So.
Okay, please look into that. I'd love that connection.
And I don't know that I have as many partnerships in Washington State. Sorry, but I just know.
Yeah, no, that's okay. That's there may be some connections through our office itself. Works under has the statewide PTI grant, Parent Training and Information around special education. I am the director of Family to Family Health Information Center around children and youth with special healthcare needs. And we have some strong connections with the state Developmental Disabilities Administration. So I think I think that triggered the ask, and I think we have pathways to do the ask through some of the programs we already have in place. So I appreciate that, because there are sometimes where we get so micro-focused that we don't stop and take a breath and look at, okay, who's already, like Easter Seals and the UCP and Epilepsy Foundation and
yeah, I think with so much of the respite coming through AOA, by the way, it was finally funded. You think of it as aging programs.
Yeah.
Ours was based, UCP's been providing respite since '94, I think.
Mm.
So, and we created Alabama Respite statewide in 2000 because we just had this disconnect on when we ran out of money. There was nowhere to refer them. So, but the disability agencies certainly have a need for respite, and if they don't already. So, and then your Department of Child Abuse and Neglect Prevention has the CBCAP funding that they may be spending on other programs. But we were successful early in that process because it is prevention, to explain the disproportionate percentage of children with disabilities that are neglected or at risk.
Mm-hmm.
And so, intentional or not.
Yeah.
And, so they do use a good bit of their CBCAP for all of the UCPs. And I think they might have funded one other project for respite in our state so that all the UCPs replicated our program here. And so that might be a group, your prevention program.
Yeah, because
they just do aging, but
no, we actually don't just do aging, which is kind of expanded things, I think. We are just starting to do this and one other program expanded us to kind of the lifespan, but for the most part, our age group has been birth to 26. So this really kind of was that next step into really connecting across the lifespan with support. And I know that our DSHS and Children's Services has respite that they administer themselves, that they do, but it's worth an ask to see, how challenging is that for them, and is there, a way to think outside that and look at, I think the challenge is finding providers that we already work with, but if they are working with specific providers around abuse and neglect, I can't imagine that they couldn't be connected with who we already use as providers. If we, like you said, it doesn't hurt to ask.
You all should know that we were instrumental in the 1990s in getting respite written into that child abuse prevention law and into Safe and Stable Families as well. And in those early years, probably through 2005 or 2010, the Children's Bureau was very supportive in pushing the grantees to use their CBCAP, that's the Community-Based Child Abuse Prevention Program, dollars for respite. But since then, there have been many competing priorities. And I think Cheryl's one of the last states to be using those funds for respite. But we work every year legislatively. We're working right now to keep respite as a core service in that program. We have the advocacy handle to ask for the money. It's just a lot harder to get now. But
yeah, our lady, you remember Java, she went, or was it Linda? I think it was Java went with our prevention program to Washington to argue because they were trying to pull it out and just fund child abuse centers and the need for the prevention. But I never like to throw a potential partner under the bus, but if they're running their own respite dollars with those funds and you have any on a waiting list or those you can't serve, particularly with disabilities, I would flood them with all those referrals. And then they can either, with ADA, they don't have a choice but to provide that across the board. And they can either increase their capabilities or maybe look for a strategic partner that knows that population. So,
there you go. Yeah, that's a great idea.
Yeah. Well, it's a need, and it's not just as easy as just
no, but I think also just talking with them about the numbers that we see, about the need. They know where they have gaps because there was just a gap analysis done when they restructured. They really restructured 2 years ago children's services. So they took kind of separate agencies and kind of morphed them into one super agency. And so they've really been restructuring internally each. So children's services and the Birth to 3 program, and I think one other, juvenile justice, all came under one big umbrella. And Division of Developmental Disabilities, I don't believe got pulled under there. Would have to look at the restructuring, but because of that, they had to do a gap analysis and really look at, did this cover? So it might be worth going in and looking at that gap analysis and seeing if respite was even a part of that visioning when they looked at that, and then asking some targeted questions, because we do work with some of those state heads anyway in some of our other programs. And
you should know too that Cassandra Furman on the Arch staff, who's based in Seattle, still works part-time for the Friends Resource Center, which provides training and technical assistance to those child abuse prevention state agencies. And I'm sure she knows the Washington person very well. So
okay, the Friends Society?
No, it's the Friends National Resource Center on Child Abuse Prevention. They're our sister technical assistance center based in the same agency.
Okay.
So Jill, I would, just like we did with the AAAs, it is amazing if, like Jill said, if they even have a respite program still, they bought into the benefits. So I would just approach them on what you can do to help them.
Yeah, partner with them. Yeah,
realizing our population is unique. Here's what I can do for you. And so
right. No, I like that idea. Thank you so much.
Or sustainability funding sources.
Yes, yes. Well, and I think that if we look at that, because lifespan respite does cross the lifespan, that it's not only just sustainability for us, it's sustainability for them. Yeah. So, you know, if you look at it on both sides, it stretches. Even if they provide funding to us, we also have funding on the back end, so that just expands for both sides. Who can support.
So then you have a guest.
I love your coworker there.
I muted for a minute because she's got the worst, most piercing part. So also, you know, that I was just thinking when you're talking about, I think, Jill McCormick, when you're talking about the gap analysis, that's just a good idea to know people that, you know, related organizations that are doing those, so you can get respite on the, you know, as part of that analysis if they don't already include it, because we know that that's what families want. That's one of their priorities. So if people are doing a gap analysis, related organizations, and they don't have respite on there, that's something to lobby for, to make sure that get that need documented. That's such a good way to go in, you know, to walk in and say, we can help you with that.
Well, I know that we were part of, we have been a part of the program with the Department of Baby Health, at the children's end of that, with intensive needs kiddos and keeping them out of home placement, and through that statewide group, which brought in families and youth, as well as all of those, you know, systems touch points for these kids. And we got respite on the legislative docket at least for 2 years in a row. So that at least statewide, the legislature hears that it's not going away. That the ask for that, that the request for that, and the amount of people, especially with acute behavioral health is a strong need for families and for resiliency in families and keeping them together. So there is a strong push in that area. It might be nice to look at it from all aspects, from the developmental and intellectual disability community, from traumatic brain injury community, from, you know, so that, and the aging community, just really so that it's you know, a broader scope of, hey, you know, we need this. So
Exactly.
Yeah, that's great. Well said. We're over.
yes.
These conversations are so rich. So I want to thank everyone. I'm trying to remember, did we meet last summer, Jill? What did we do last summer? Do we want to meet? Are people taking vacations? What are your druthers?
Yeah, we do have a meeting scheduled, I think, for July 24th, but only if people are going to be around.
Are people going to be around?
Yes, we will be.
Okay, let's do July and then take August off. And then
That would be fine. We might have to take August off anyway if Arch doesn't get continuation grant.
Then for sure we need to meet in July for our swan song.
That's best an announcement, Jill. I know.
I'm a little bit nervous that I haven't heard from the federal budget office yet with questions. Usually they have a lot of questions for you if you're in the running. And I'm supposed to hear earlier than all of you because my project ends July 31st. So.
Okay, so be there or be square for July.
So you have not heard anything.
Not a word.
On the congressional budgeting, did I know they approved 2 different amounts? Did they ever finalize that amount?
Oh, the fiscal year 21 appropriations bill? Oh, no, they're actually next week, the House subcommittee is meeting. And I've got a letter circulating now from national organizations to support an increase. And the Senate should be meeting soon thereafter. But who knows what's going to happen with the FY21 appropriations bill? They haven't even set the allocations yet because of all the budget disastrous things that are happening. There could be huge cuts because of, you know, the huge expenditures we had with the recent supplementals.
Yeah.
So,
and I was wondering how that was going to impact them making commitments for 3-year funding cycles.
Well, the money they're spending now is fiscal year 20 money. Yeah.
Okay, so it's really good.
They can never commit. I mean, you see in when you get your award that it's dependent on annual congressional appropriations.
Yeah.
So that's always an issue.
By starting September 1, I thought that, but never got confirmation it was last year funds. So
yeah.
Thank you.
Yeah, we're always we're a year behind. I mean, they're usually awarding the fiscal year 20 funds at the end of fiscal year 20 or the end of the fiscal year. So.
Well, I've never heard any conversations, and I was just wondering if even the federal budget offices were waiting on better June quarter numbers or something to even get back to the budgeting. But I keep telling everybody, just because they passed that they wanted to help us more, I don't think that's been across the finish line. And I think it might.
Yeah.
Are you getting rumors that it might be very late in the budget cycle again, or?
My guess would be that it will be, yeah. Especially since this is an election year. They're not going to be here as much. Well, they haven't been here that much to begin with, but even less than usual. So I think it'll be significantly delayed. Your final FY21 funding.
Reauthorization up to a certain point.
Continuing resolutions that keep programs running.
I mean, yeah.
At current levels, yeah. That's my guess.
All right, so if they do that current level and they then cut us, that means the cuts will be 9 months.
Yeah.
9 months. Well, like you said, that won't affect us. I guess it'll really be us next year. So.
Right, you have a year away to, hopefully maybe things will rebound a little bit. I don't know. It's going to be a rough budget year for state level and federal.
Yeah. Well, we're okay for now, except I really wonder if we're going to end up being prorated at some level, but So we,
I mean, if the pandemic continues on and resurges terribly in the fall, which would be a horrible, horrible, horrible thing, my guess is that Congress hopefully will continue to provide support. But I mean, we have this wonderful House bill that's pending now with increased funding for a lot of disability and aging programs, and the Senate is refusing to move it. So it's very scary.
Mhm.
I don't know what the next steps will be. Well, we're losing people anyway. We could chat all day. Cheryl, I could spend all afternoon catching up.
I
But
know.
I don't know, I feel like I just got, those girls just are doing great, and it's not where I've been needed, so I feel like I missed y'all. When I saw it was popped, I'm actually at my desk for a change. Usually it's like 45 minutes in, and then I get to my desk and it says, reminder, you missed it. I'm
Well,
never
I'm
at my
so
desk
glad.
lately, so I thought, oh, I can do this one. So
that was a
thanks.
treat. So thank
Yeah,
you.
it's really a treat.
Yeah,
It's-
miss
you're
seeing you
welcome.
all. Miss seeing you at the virtual town hall. Yeah, I mean the meeting that you all had, and I
Oh, the
understand
grantee meeting. Yeah.
But,
Yeah, it was really good. It was very,
Yeah.
lots of good information shared.
yeah, I know Brittany was there, but we even Tracy was out of pocket. So
Yeah. You
Sorry
can
about that.
watch it on tape. It's
Your spare time.
how many
Yeah.
hours was that?
6
yeah,
hours.
a lot. But the actual
Okay.
presentations by the states were like total of what, 2 hours?
Yeah. 1 hour each day of state presentations.
And they're worthwhile. They
Good.
were.
We even had Lance Robertson for 5 or 10 minutes.
I heard he was. Yeah, that's
That speaks volumes about how much we're on the radar in ACL. So that was very encouraging.
that is good.
We lost Utah. Sorry, Utah.
Well, I feel like I've just totally disappeared, but you know, y'all are in good hands, and they're doing a great job. And
You have so many other programs to worry about right now. We totally get it. And your girls are doing a great job.
well, it's always good to hear. So, all right,
I
well,
love
you all be
watching-
safe. Stay safe.
You
And
too. Take
all
care.
righty, talk
Bye.
soon.
Be well.
Bye-bye.